you are joining us from. I am Chief Bill Smith, Chairman and the Alaska Area Representative of the National Indian Health Board, and I'm also a Vietnam vet. It is my pleasure to welcome you to the 2021 National Tribal Health Conference Veterans Affairs listening session. Before we begin, please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the session at this time. Awata, and thank you. All right, as it is customary, we'll start this meeting off in a good way with an opening prayer. And it goes, Creator, we need you. Please forgive us, sweep through our nations and heal our lands and our people. Restore our strength, renew our minds and our souls, and cast out everything that is not of you. Amen. All right. During this session, we'll be speaking with Mr. Denis McDonough, the Secretary of the VA, and other key leaderships from the department. We appreciate the engagement with the Secretary and his leadership team, and we're looking forward to discussing the host of issues that are important to our tribal nations. To lead this session, I'm glad to be joined with the National Indian Health Board Vice Chair, Councilman Nicholas Lewis. Nicholas, it's up to you.
Thank you, Chief Bill. As you mentioned, we have many issues that are extremely important. There are a variety of topics that we would like to discuss today, which include reimbursement for healthcare provided to our American Indian and Alaska Native veterans, the newly created VA Tribal Advisory Board, as well as any other quality or access to care issues that are relevant to our American Indian Alaska Native veterans. As a tribal leader, and as tribal leaders that are here today, we appreciate the time that we have with the VA so that we can share our guidance and recommendations on a variety of issues. This is a dynamic time, and we want to ensure that tribal leaders and their perspectives are heard, understood, and incorporated into the VA's work. Today, we are joined by the Secretary and members of his leadership team. Among those joining our Secretary of Veterans Administrations are Mrs. Stephanie Birdwell, the Director of Tribal Office of Tribal Government Relations, Dr. Clinton Greenstone, Executive Director of the Clinical Integration and Field Operations for the VHA Office of Community Care, and Dr. James Shore, Population Specialist for the Veterans Health Administration. To start us off today, Secretary will share some of the comments and updates. After that, we will open our discussion portion of the meeting. Due to scheduling conflict, the Secretary will only be able to stay for the first half of today's session, but his team will be present throughout the session to engage in the meaningful discussion with you all. Like many other listening sessions, we will follow tribal protocol and invite our elected tribal leaders to take the comments first, share their recommendations, and ask questions that they have. Once our tribal leaders have the chance to speak, we will open the floor to other members of the audience. And now, to provide us with opening remarks, it is my pleasure to introduce the Honorable Denis Richard McDonough. Secretary McDonough was nominated by President Biden to lead the Department of Veterans Affairs and was confirmed by the United States Senate February 8th, 2021, and was sworn in the following day as the 11th Secretary of Veterans Affairs. During his confirmation hearing, the Secretary testified to Congress that he will work tirelessly to build and restore the VA's trust responsibility, or the VA's trust as the premier agency for ensuring well-being for our America's veterans. Secretary, it is good to have you with us, and thank you for taking the time to be with us here for this important meeting. I will turn the floor over to you and your team.
Councilman Lewis, thank you very much for that kind introduction. Chief Bill, thank you too for inviting me today, and I thank you both for your service to the nation in and out of uniform. Let me also acknowledge all the tribal leaders, tribal elders, and veterans on the call today. And so I start by saying greetings, everyone. I come from Minnesota, so I want to say anin and how. I also want to take a moment to recognize that I'm on tribal land, since all this country is tribal land. And I want to note that I proudly come from a state where there are 11 federally recognized tribes. That land, according to what I understand from the Ojibwe, is land where food grows on water. And on one of my last trips home, I had the opportunity to meet with Chief Executive Melanie Benjamin, Chairwoman Kathy Chavers, Archie LaRose, and Renee Van Nett. And I was pleased to bring back with me some of that food that grows on water, manomin, which is wild rice, and it's delicious. That visit reminded me once again of my great respect for your land, your culture, and your heritage, but also reminds me of our shared culture and our shared mission. And that's what brings me here today. I want to reaffirm my deep commitment to our common heritage, to our partnership, and to the work we must do for tribal veterans, their families, survivors, and caregivers. At VA, we respect tribal governments and tribal sovereignty. We'll make every effort to consult with you and tribes before we make decisions that affect tribal governance and tribal citizens. And to borrow a phrase, my commitment is that we won't make decisions about you without you. And you know, the president often says that our most sacred obligation is to prepare and equip the troops we send into harm's way and to care for them and their families when they return home. We at VA are among those most responsible for fulfilling that sacred obligation. We cannot do that work without you. So thank you for your partnership, for having me here today, and for all that you do. Our shared work and everything we do at VA is guided by 4 fundamental principles: advocacy, access, outcomes, and excellence. Before I get to your questions, as the Vice Chairman said, I want to quickly touch on each of those and discuss how they pertain to the work we do together. First, on advocacy. We're working to make sure VA is the nation's premier advocate for tribal veterans and all veterans, their families, caregivers, and survivors. Because veterans have earned the care and services we provide, and we exist to best serve them, not to do what's easy for us. That's why VA is standing up the first ever Veterans Affairs Tribal Advisory Committee very soon. That council will help us collaborate on tribal veterans issues with those who best understand those issues. And when it comes to advocacy, it starts at the top. Our shared mission could not be a higher priority for this administration, nor could it be closer to President Biden's heart. I'm honored to serve as a member of his cabinet and to work for a president who is committed to making meaningful progress in Indian country. One example is the White House ongoing tribal consultation about removing barriers to voting, an effort that VA proudly supports. Another example is the White House Council on Native American Affairs, where I serve as a co-chair of the Health Committee. And along with Secretary Vilsack and Secretary Becerra, I look forward to discussing how our agencies are collaborating on health priorities for Indian country at the White House Tribal Nations Summit next month. It'll be a great forum for me to take the lessons and questions I hear from you all today and use them to continue moving the ball forward for tribal vets. Second, access. We'll move heaven and earth to get veterans timely access to their VA resources. That's world-class healthcare, that's earned benefits, and it's a dignified final resting place that's a lasting tribute to their service. A major part of that equation is making sure that tribal veterans, their families, survivors, and caregivers has the best possible experience wherever they access VA services. That's why we're meeting vets where they are by expanding telehealth and teleappeals and supporting our caregivers. Since the pandemic, more than 88,000 telehealth encounters were conducted with American Indian and Alaska Native veterans. Also, because of the more rural nature of many tribal lands, VA is developing a rural veteran navigator program to streamline care coordination for veterans who use VA, Indian Health Service, and tribal health programs. While the Navigator is still in development at the Office of Rural Health in Salt Lake City, its goal is to improve health outcomes for rural vets by using evidence-based approaches to increase their access to health care and associated benefits. If you have questions on the Navigator program, Dr. Jay Shore is on the call today and will gladly offer more details about the program in the listening session. And look, our work on increasing access is just beginning. In order to ensure effective delivery of tribal veteran services, VHA is also establishing a new office to help coordinate issues related to tribal veterans' health. Our goal is to have that office up and running by March 2022, and we look forward to working with you to bring it to life. Next, outcomes. Outcomes drive everything we do because vets, not us, are the ultimate judge of our success. Throughout the pandemic, the most important outcome for all of us has been helping those we serve and those we love to stay safe. Sadly, tribal communities have been especially hard hit, with the pandemic impeding many tribal governments' abilities to provide basic services at a time when demand for those services is surging. So let me assure you this, we hear you, we are committed to doing everything to help. And to that end, we have deployed personnel across the country to support facilities serving American Indian and Alaska Native veterans. We also supported non-veterans as a part of our fourth mission, working with IHS every step of the way. To date, we've deployed 214 doctors and nurses in support of Navajo Nation. We've developed many ICU and ER nurses, or we've deployed them, as well as emergency response workers across the state of Arizona. We've provided beds to support IHS at VA medical centers in Oklahoma, Colorado, and New Mexico. And we sent a physician and a nursing team to support the Mississippi Band of Choctaw Indians at the Choctaw Health Center. And we're not just trying to plug holes. We want to make sure that what's happening now never happens again. That's why I'm excited to announce that this very morning, VHA and IHS signed the updated memorandum of understanding that first came into effect 10 years ago under the Obama administration. What's new and relevant about this MOU is that you will see evidence of policy updates in real time, where the goal is to enhance and improve the care of veterans who are users of VA and Indian health systems. We plan to formally notify tribal leaders and the urban Indian organization leaders by letter and direct them to where they can find the MOU online. And finally, we look forward to participating in a dialogue with tribal leaders and health organizations called Nation to Nation later this fall. The dialogue, which tribes requested, will bring together representatives from the White House COVID team, DOJ, DOT, DHS, DOI, and HHS to hear tribes' perspectives on how to help them through this public health emergency and be better equipped to make it through the next public health emergency. Finally, excellence. We're seeking excellence in all we do for veterans by leveraging strength and diversity that defines the American population, the VA workforce, and this amazing country. Because diversity is a strength, never a weakness. Every person entering a VA facility must feel safe, free of harassment and discrimination, and we will welcome all veterans. Now, there's much more I could say here, but it all boils down to this. For too long, too many veterans who fought around the world to protect our rights and freedoms have had to fight brutal battles here at home for their own rights and freedoms. Too many tribal veterans fought for our freedoms, for my freedoms, then were denied those freedoms themselves. Tragically, some of those fights continue today. But at VA, those fights are over. In this administration, nobody is going to have to fight to get quality care, benefits, and services they've earned, no matter who they are. So that's where VA is headed. Continuing to deliver more care, more benefits, more services to more veterans with advocacy, access, outcomes, and excellence as our guiding principles. But I'll say it again. We can't do it without your help. We need the strong support of NIHB, the National Congress of American Indians, whom I met with earlier this year. It's when I first met you, Chief, and every tribal leader and elder to ensure we accomplish our mission. And we need also to work in Washington, whether it's with the White House or Congress, to better serve tribal communities. For us to make any progress, that work has to happen on both sides of the aisle. Fortunately, as you all know, Senator Tester of Montana and Senator Sullivan of Alaska, a Democrat and a Republican who sit on the Veterans Affairs Committee, are fully engaged thinking about the future of VA's relationship with Indigenous Americans. Prior to my meeting today, I reached out to both to make sure that my message was aligned with their priorities. Senator Tester shared with me that together we must think beyond the present and consider how to preserve Native land for future generations. And he believes the best way to strengthen our partnership with Indian country is to ensure you always have a seat at the table. Senator Sullivan represents the Chief's unique state of Alaska, which boasts more veterans per capita than any other state in the country. And at his urgings, I've dove into understanding VA's reliance upon its partnership with tribal health system to accomplish our mission of serving Alaska's veterans wherever they are. That critical partnership will help us cultivate direct relationships and maintain trust with tribal leaders, something absolutely critical to effectively fulfilling our promise to all veterans. But here's the issue. Not all vets who live on tribal land and within tribal communities have access to suitable representation for their VA benefit claims. Despite VA's efforts to improve access to representation on tribal land, by revising regulations to permit tribal organizations to be recognized as VSOs, we've not seen a significant increase in representation that's being provided to Native American and Native Alaskan vets. So to facilitate representation for Native Americans and to ensure that representation is culturally competent, VA is initiating the Tribal Representational Expansion Project. Through this project, I've delegated discretionary authority afforded to me by Congress to the General Counsel to authorize certain tribal VSOs affiliated with tribal governments to prepare, present, and prosecute veteran benefit claims before VA. We'll be reaching out to the tribe soon to discuss this initiative. And this is just another step in VA fulfilling our obligation to Native American vets and to earning your trust. We're all painfully aware of the federal government's history with tribal nations. It's measured by death, stolen land, and most recently, decades of broken promises. Even tragically, unaccounted for kids. But those promises will no longer be broken, not on my watch, not on this president's watch. Now for the nearly 24,000 American Indian and Alaskan Natives defending our freedom today, and not for the more than 140,000 Native American veterans receiving their care at VA. All of them rightly expect the nation, the United States, to fulfill our obligations with the same degree of dignity and fidelity with which they put their lives on the line for this country. They've served our country extremely well. You have served our country extremely well. But for generations, our country has not served you as well as we can and should. It's my job as secretary to change that. It's VA's job to change that. And with your help, we are going to change that. So on behalf of VA, I thank you again for the opportunity to be with you, and as more important, for your leadership of the nations you represent. Thank you for all that you're doing to help our nation's tribal veterans, their families, caregivers, and survivors. May God bless them. May the Creator bless them. And may we always give them our very best. I look forward to your questions.
Thank you, Hawata. I know our time is short with you and that you must be leaving soon. I just want to hear from you, your words that when we speak to the rest of your support staff, that those questions and those comments will get to you as if you were still in the room. Because like I said, when you talk about tribal veterans representatives, there is a shortage of how a veteran can get signed up into the VA system, because the downfall is between the tribal veterans representatives and the service officer. It all funnels down into one section, and then the veteran also has to have faith in whichever service officer that he speaks to that can speak to the VA for him.
Yes,
A tribal veteran representative can only bring him to the door
yep.
and not let him help him. And that's a downfall. We need to fix something where we can help all our brothers and sisters that need to come back to the VA, because this is a new VA.
So Chief, three things. Yes. My team, the team that's on here are my people. They speak for me and I for them. 1, 2, I'm not leaving until we've had an opportunity to have a listening session. I didn't come to the listening session just to talk. And I also know I'm late, so I'll stay until I have an opportunity to listen. Third, your last point is that it is expressly why we are cranking up the tribal representation expansion project. And we'll have more to say about this at the Tribal Nations Summit. But I agree with you that the way of doing business is insufficient. We'll have more very concrete details for you going forward, including at the Tribal Nations Summit. But this is something you, Chief, raised with me the first time I talked with you. And I said, the next time I talk to Chief Bill Smith, I want to have an answer to that question. So I don't have a full answer to that question, but I have a partial answer, which is we have something new in the works. It's called the Tribal Representation Expansion Project. I hope we have the I's dotted and the T's crossed when we see each other at the Tribal Nations Summit.
Okay, thank you. Thank you very much for those updates and your important information. Now we'll start the discussion portion of this meeting. Our National Indian Health Board directors have a few questions to start off with. I would like to invite my fellow board member and vice chair of the National Indian Health Board, Nicholas Lewis, to ask the first question. Nicholas?
Thank you, Chief Smith, and thank you, Secretary, for sharing the words that you did and really going into the detail that you did, acknowledging the truth of the history and the failures of the federal government. It is greatly appreciated, and hearing your reassurance that under your watch and President Biden's, that will change. And so I just want to acknowledge your comments and appreciate the things that you said, and even acknowledging that, even if a few minutes late, that you're going to stay and give our tribal leaders the respect to listen and have the conversation with them. That always isn't the case in these. And so I, again, appreciate your commitment to our tribes and tribal leaders in making the time available. I know your time is very busy, but had to acknowledge that. Thank you. You did answer.
I work for you, so.
That's good to hear. And as you can see in the background, I have a Navy flag. And as Chief Smith is a veteran as well, and I know some of the other speakers, I signed up for the Navy when I was 17 years old, before I even graduated high school, and served 8 years in the Navy, and some of the best times of my life. And learning from Chief Smith and the other veterans that are active, this is really important, this discussion with you. So on behalf of all of our veterans. So hearing that the MOU was signed with IHS, I guess my question kind of shifts to wondering how the VA and IHS will work through future pandemics, if unfortunately they ever happen again, We understand that there may be the MOU between IHS and the VA to improve coordination in those future pandemics. Can you update us on those plans? I do have a few other questions, and I don't know if you prefer to answer every question after or have a response after, or do you want me to keep going?
Whatever, I'll do whatever is best for you.
Okay, so that was one. The other question or request I have is that the MOU should have goals and objectives similar to those of the tribal health programs that include quality service and culturally responsive care for our Native veterans. The other thing, the MOU, it is great that it was signed. The one thing that I think with all documents that are signed is they need to be living documents. You know, as we go down this road together, that if we do start to see challenges, that we can work on amending that, and would like to hear the commitment on that if there are issues. And then there is one, I think that this is something that affects all Indian country, that, and it is known that Native Americans have served at the highest rates in the United States military. And on that, I'd like to give a Lummi perspective. And I talked with our veterans director, David Jefferson, this morning to ask a little bit about his thoughts. And one of the things that he had shared is we have, in our small community, we have over 90 veterans. And we are a small tribe of over 5,000 people, and that is an extremely high amount of veterans. And we're starting to see our veterans age, and we don't see long-term housing or care for them. In our Native culture, we try to take care of our own. We don't like sending our elders away. We have grown in ways that I don't think many other people's see it the way we do, but we would rather stay with our elders and make sure that they're taking care of ourselves instead of sending them away where we don't know that the care is adequate. And so I'd like to see a commitment from the VA to work on more housing, long-term care facilities for our elders, especially as they start to age. And they think from a Native American lens, when we have served at the highest rates, that should have a heavier weight in priority. So thank you. If there's any questions or comments you have on that.
Yeah, thank you very much. I'm gonna, just as a warning, to either to Dr. Shore or to Stephanie Birdwell, if you guys have any thoughts on the first question, which is what are our lessons learned to date on future VA IHS collaboration learned from the current pandemic. I'm going to go to you guys on that last because in all candor, I don't have the most recent on that, but I think one of you may. So you have three things, Councilman, that you raised. So let me just do those real quick. One is this is an ongoing living and breathing document, but also this is an ongoing living and breathing relationship between us and among us. So as we're executing the MOU, we'll be in constant consultation with you, and we'll be looking for feedback from you. So if there are issues that we address that need to be updated in a next draft, or a next MOU, you have my commitment that we'll do that. And the questioner has my commitment that we'll do that. Two, on the need for our care of our Native veterans to be culturally competent, both as veterans, but also as Native American vets, Native Alaskan vets. I can't speak to the specific language of the MOU because I've not looked at it now in a couple of weeks. But you have our commitment, and one thing we pride ourselves on is our culturally competent care. So that's going to also require us to maintain this vibrant relationship with the NIHB, because you can help us with cultural competence. Third, on long-term care, this is one of the things that I think will also, I was glad to see you coming on, Stephanie. You shouldn't take yourself off. On long-term care, we are spending more and more on care in the community for home care, for specialty home care. And so we should continue to have this be a fundamental part of our dialogue on how best do we care for our Native veteran seniors, and is it in home care settings or is it in residential settings, as I think your questioner anticipates. I think we should discuss that, but in all cases, we're committed to making sure that we fulfill our obligation through all stages of our veterans' lives. And we do it in a way that honors their service and honors who they are as Native veterans. So let me just see if Stephanie or Jay have anything to say on the first question, Nick, as it relates to collaboration at the, as outlined in the MOU. And sorry, not as outlined in the MOU, in terms of anticipating problems in future pandemics and what we've learned from this one.
Sure, sir. I'll go ahead and start and ask if Jay can kind of fill in the end. But what I would say is that that the present experience is definitely going to be informing future action. I think that we're going to have a rich dialogue with regard to the nation-to-nation discussion that's going to be coming up with the federal family and tribal leaders at the end of October. And I think there's a lot of, again, like rich action that we can draw on that is going to better prepare us and effectively prepare us to be responsive to future pandemics. And I think also a couple of things are different now as we move forward. Is there's of course the interagency agreement that was established between the VA and the Indian Health Service that came about mid part of 2020 as part of VA's fourth mission to support the country in the midst of a national crisis. But something that's really important is how do we look to creating those IAA relationships between VA and tribal health programs and tribal governments. I think that that's something that should be evaluated looking forward. And I think two things that are new on the horizon are the advent of the VA Advisory Committee on Tribal and Indian Affairs. That's going to guarantee more consistent relationship and communication with the highest levels of the department, the secretary and the tribal representatives. So that's going to be something that's going to be new and I think very compelling for future policy and action. And then also I think the creation of the VHA Office of Indian Health or whatever, you know, its final kind of title is. But I think that will also better inform how VHA is going to really coordinate with the entire family of Indian health providers, whether it's IHS, federal, tribal, or urban Indian organizations, to be effectively responsive in the instance of the future pandemics. Jay, did you want to kind of weigh in on that as well?
I guess the only thing I would add was sort of the lessons I learned at the patient level. I've been advocating the use of video conferencing for 20 years with veterans, and I was sort of like the dog that caught the mail truck and didn't know what to do, because as we've entered this pandemic, the ability to video conference has been so critical. But we've also learned about some of the barriers which we knew were there, but were accentuated by the pandemic, about our patients having the access to the bandwidth, the technology, the barriers to get the virtual care, which we need to and have pushed in to address more. And I think it's also important as we emerge from the pandemic, I think use of this virtual care will be more prominent, but at the end of the day, how do we tailor that care so it really works for the individual Native veteran we're working with and their community and organization? You know, what type of virtual care when, and how can we also phase back in that important in-person contact and when we need to do it. So these are critical lessons we've learned during this pandemic, and we'll really need to focus on it as we emerge to continue to render adapted care for the veteran in front of us on a daily basis.
Thank you. There was one last question I had, Chief Smith, and that would be about that what we feel is one of the most important measures of the MOU success will be the adequacy of the reimbursement agreements, particularly the ability of the Indian Health Service system to be reimbursed for care provided to our American Indian and Alaska Native veterans. Is there anything that you can speak to on the status of these agreements between the VA and IHS? And then is there any barriers that you've been able to identify? I talked with our billing office this morning also about our billing from LUMI perspective and how that goes. And one of the things that was shared is it is easier for our staff to get our veterans and just people in general signed up for Medicaid, Medicare, but it is a lot more challenging to get our veterans signed up for VA care. And so I think that's something that we need to work on more in making sure that tribal programs and staff have the same training and support to get our veterans signed up for the VA care so that the tribes can start billing. So that was one of the barriers I heard this morning. But if there's anything you can speak on those areas, and then that's it for me, Chief Smith, and to our VA partners, thank you.
Nick, thank you very much. I'd say a couple of things. One is we are working through with IHS to understand reimbursement rates, where there's a question of whether we stick with the Medicare rates of reimbursement, which would be, I think it's Stephanie J, you guys correct me if I'm wrong, but I read this to say that we'd be comfortable with that. But there's some question about whether we would, if IHS chooses to go with something other than Medicare rates, in which case we'd have to revisit our views on this. In all cases, though, we are committed to making sure that the reimbursements, whether it's for direct care or for purchased care, are handled in a very expeditious and timely way. One, and then two, on this question of the LUMI Nation and getting having a relatively easier time for our vets to get into Medicaid or Medicare than into VA. I'd love to just hear more about that. If you even have some notes on that, Nick, and you can send them to me at dennis.mcdonough@va.gov. We'll dig into that. But let me just make sure I haven't screwed up my answer by leaning on the real experts in Stephanie and Jay.
So, sir, currently the reimbursement agreements are reimbursed at the all-inclusive rate, which is a commonly accepted rate that's approved. It's sometimes referred to as the OMB rate. And so that's the precedent. There is some discussion about when it comes to the urban Indian organizations who've been authorized to now participate in this purchase care relationship, what the rate will be for reimbursement for them. But the existing reimbursement agreements are at the all-inclusive rate. And I would say to Councilman Lewis that we absolutely hear you and look forward to coordinating a stronger technical assistance when it comes to enrolling veterans in VHA healthcare and strengthening the reimbursement agreements in the future.
Thank you very much. Chief Smith, you're on mute.
Thanks, Nicholas. Thank you again, Awata. And I'd like to bring up one other thing on a barrier, and that's the pharmacy billing for reimbursements. Alaska tribal providers are still being asked by the VA to send pharmacy claims via paper. Current VA is anywhere from 60 to 180 days. We have reached out to the VA several times on how Alaska tribal providers can send them electronically. We believe this issue stems from incompatible of the pharmacy IT system, and the VA should confirm if this is an issue and provide guidance on electronic pharmacy claims. And the other one is currently Alaska tribal providers must send paper claims to Vancouver, Washington. VA Processing Center is a slow process where the claims are supported to be scanned into the VA system. Then those claims are mailed to the Florida Center to be adjusted. This procedure results in slow correspondence on the claims and sometimes no response on the claims until third and fourth attempts contacting the VA. Alaska tribal providers also experience untimely filing claims denied due to VAs not having scanned the paper claim into the VA system at the Vacoma Processing Center. This is also resulting in denied claims not shown in the VA claim portal. For example, if there's a denied claim for a diagnostic code, providers are not getting the denied letter sent them, and it does not appear on the claim portal. And for me personally, I get letters from the VA claiming this is denied, and then the next day I get a bunch of letters saying that it's been paid. So as a veteran, it's kind of confusing. So I can imagine what the providers are going through with the paperwork. In the day of when we're talking about electronics, it should be a lot quicker than Pony Express.
Yeah, you're right about that. And it's hard for me to disagree with what you said, but Stephanie or Jay, do you have anything specific on expressly on this question of why we can't just simply accommodate an electronic request for reimbursement on pharmacy services? And then relatedly, if the answer is there's a statutory obligation, Chief, we're going through a bunch of those at the moment where we'll ask for relief from Congress on it. But do you know, Stephanie or Jay, whether there's something else going on here?
I would defer to Dr. Greenstone or Kara Hawthorne, who are also on the line from VHA.
Oh, great. Okay.
Yeah.
Yes, good afternoon. This is Dr. Greenstone from the Office of Community Care. And, so certainly, Chief Smith, we certainly hear this issue. So from a claims perspective, you're right, that if we are able to receive electronic sort of claims, we can expedite much more easily and quickly the ability to pay those claims. When they do come in to us via paper, we've tried to expedite getting what we call the paper to electronic process to try and help expedite that. But the fastest way is if we can actually receive electronic claims. So I will work with our team to make sure we have a better understanding of where some of those challenges and barriers are. It really troubles me to hear the confusion that you as a veteran and other veterans may have. So we'll work very closely with them to have some better understanding of what we can do to improve that process. And to the extent that we can receive electronic claims, we can certainly adjudicate those much more quickly. From a perspective of pharmacy, as well, as you may know, we're working on a electronic sort of pharmacy prescription process to be able to actually receive those also electronically. And so I know that our office is working very closely with that, and that we hope sometime during this year we will have those processes electronically built across VA so that we would be much more efficient in paying those electronic pharmacy claims as well.
Okay, thank you for those responses. All right, and now I'd like to invite National and Health Board alternate Councilman Nate Tyler to ask a question. Nate, you there? AC, is Nate on our Zoom meeting? This is one of the things I really dislike about being in the Zoom instead of being in person.
Oh, he should be able to speak now, Chief Bill.
Okay. Can you hear me, Chief Bill?
Yes, Nate, I can hear you now. Thank you.
Okay.
Hawata.
Good morning. Good morning, Secretary. I have two questions. You partially answered one. My name's Nate Tyler. I'm a delegate to the Northwest Portland Area Indian Health Board. That's 43 tribes in Washington, Oregon, and Idaho. So I'd like to throw a pitch in there. You mentioned NTAI and also the NIHB, but we also have the Northwest Portland Area Indian Health Board also. I'm a veteran also, a disabled veteran. I too joined when I was 17 years old, my junior year in high school and deployed to 2 conflicts, the first Gulf War and then also Somalia. So being a veteran elevates, what we do as tribal leaders and trying to help our veterans. I come from a small tribe, Nia Bay, Washington, 3,000 members. And we also have quite a few veterans in our community. So the question you partially answered was about the VA TAC. I was kind of curious on when the first meeting is going to be and when your selections are going to be. And also if you got all, what was it, 16 names of interest throughout the nation. I think that's pretty important to stand up that TAC so we can work together, on creating a charter and also consultation, be a part of a consultation. I think those two things go hand in hand on what we can do together between tribes throughout the nation and also the VA. So two pretty important things. And as far as consultation, the last time we had the consultation a couple months back, I don't remember seeing any official documentation going out to tribes on that. So I think if we can do one more consultation, that'd be really good. If we can reach out to all the tribes in the nation and give us some time, 30 days notice to consult with the VA on issues that are of the utmost importance to tribes and to the VA. So them 2 questions, and for myself, it's a 5-hour trip to the nearest VA. So, there's a lot of tribes throughout the nation that is similar is what I have to go through to be seen at the nearest VA hospital. So the advisory committee, curious on that.
Yeah. So on the consultation, Nate, first of all, those are some beautiful kids in your picture there. On the consultation, I can't make a commitment on that, but I can tell you my principle is that we consult broadly and regularly. I'll find out if we have time for one more consultation, but I can't make it, just in all candor with you. I can't make a commitment on it, but I hear you, and on the principle, I'm with you. Let me just see if we have time. On the TAC, I can tell you that without making an announcement right now, I think an announcement is imminent. There is a package going through this building, and by package, I mean a file with a great number of highly capable representatives from all around the country, from many tribes and nations, from each of the services, and I'm thrilled about it. So that announcement is imminent. So I can't say. I guess I could say it's days rather than weeks or months, or days or weeks, but definitely not months. And I can tell you that the representation on the TAC is like the representation on this call, first rate and excellent. I cannot tell you, but maybe Stephanie knows the date for the first meeting.
Sir, right now, it looks like this is, don't completely rely on this, but with the White House Tribal Nations Summit happening the week of November 8th, we're also mindful of the holidays coming up, but we would really like to have the first convening of the TAC before the end of 2021. So that means we would be looking at either the first week of December or the second week of December would be the drop dead date. But that's what we're hoping to be able to pull together.
Does that answer your questions, Nate?
Yes, appreciate that, Secretary.
Okay, Chief, I hate to say this, but I have a call in 4 minutes with one of our congressional overseers. And other than my wife and the president, they might be the only people I can't say no to. So I am going to take my leave if you don't mind and make sure that I'm ready for this phone call with Mr. Bost from Southern Illinois. But I appreciate you making time for me. I beg your forgiveness again that I was late because of my mishandling of the link. But I value deeply our partnership, and I look forward to continuing it. And Chief, if we keep scheduling these meetings, you're going to keep making me beat up everybody in this building and make sure I have answers to your questions before the next time I see you. So I don't know if that's part of your strategy, but it seems to be working.
Oh, I have to thank you. And yeah, that is kind of the strategy, because we're standing up for our veterans, our brothers and sisters
Amen.
that stood in harm's way. So I want to say, Awata, thank you for staying as long as you have. And we appreciate all you and your staff being able to listen to us. So thank you again.
Thank you, Owata. Thank you. See you. Thank you, Councilman Nick. Thank you.
And I have one more question for you guys before we open it up, if we have time. And it's about the proper reimbursement care for the Native Veterans Act, amended the Indian Healthcare Improvement Act to clarify the requirements of the VA and the DoD to reimburse Indian Health Service for certain health care services, regardless of whether such services are provided directly by the service, an Indian tribe, or tribal organizations, or through purchase and referred care, or through a contract for travel. Section 213B also requires the Secretary to provide fundings for travel costs of patients and their qualified escorts associated with receiving health care services. A qualified escorts include an adult, including the parents, guardian, other family members, who is required because of the physical or mental condition of age of the apparent patient, or the health provider for the purpose of providing necessary medical care during travel by the patient, or other escorts as the Secretary and a permanent Indian health program determined to be appropriate. And I have two questions and one request. And the first question goes like, what is the status of the amenities to reimburse tribal programs under the existing VA reimbursement agreement for the PRC service? And that request is, we recommend that VA Indian Health Service and tribal programs appoint a work group to develop amenity to ensure that all issued related to PRC services, patients, and escort travel and billing reimbursements procedures are taken into consideration by the VA. This should include lodging as well. And then the last question is, does the VA plan to consult with tribes in the development of the amenity and unliability imposed it to the tribes to sign? And one of the reasons I'm asking is I get a notice from the VA telling me I got to go up to Anchorage, which is 306 miles away, about a 6-hour drive in the wintertime. And they don't have anything for housing. When I use my Indian Health Service, when I go to Anchorage for my Indian Health Service meetings and appointments, I have patient housing. I have deals because it's a burden on the veteran or anybody to travel that far and not have their housing reimbursed. I was told once by the VA that, oh, if you have 2 different appointments on 2 different days, we can support you. But they said, we can fly you up and fly you back. Well, you don't fly in and out of Valdez every day. So when I go to Anchorage, I ask the VA, and I still have not received my confirmation that they will support my housing when I go up there for the meeting that they say that I'm supposed to attend for my annual exam. So thank you.
Chief Smith, I'll respond to part of that, and then I'll refer over to Dr. Greenstone. But something I just want to make folks aware on this call is that I believe the VA Tribal Advisory Committee has the authority to establish subcommittees. So I would think a work group focusing on implementation of that provision would of course, it's up to the Tribal Advisory Committee to determine what their subcommittees will be, but I would think that would be likely a prime topic if that's something that they want to take under consideration. So with that said, I'll turn the substantive response over to Dr. Greenstone and Kara Hawthorne as well.
Now, I'll ask Kara to hop on this. I know that, Chief, that the travel issue is so important for you and many other veterans around. And there are very sort of specific sort of authorities that we actually have to reimburse or pay for travel or to actually house veterans who do have to travel long distances. And so I'll ask Kara, do we have any movement on some of the requests that we've made to actually work on expanding some of the authorities that we have for travel? Because I'm not sure if we the specific answer to your question, Chief, although I know that it is a big one and that we've tried to entertain with others. Or whether Jay, if you know, as well. I know, Kara, you're on mute if you.
Right. Can you guys hear me now?
Oh, there you are. Thank you.
Okay, great. So a lot of what you speak of is actually Benny travel that would go along with your VA care. But you are right in the expansion to include PRC. There is reference to contracted travel, and we are working really to identify, what that contracted travel consists of, and a range of other questions. We've been primarily talking with IHS. We have included the tribes as well, but we know that there are some really key questions that are going to impact both IHS and THPs that we're working through on the broader implementation, not just in regards to the contracted travel.
Okay, thank you. And hopefully we'll work it out, because I'm not the only one that travels. You just heard from Nate that even down there to get to the VA facilities, he's 5 hours away. And that's the same thing over here. If we had to travel 6 hours in most places, we already crossed 2 or 3 states. So, and like I said, with this whole COVID thing that went up, I seen hotel rates in Anchorage go well over $300 and some a night. So as a veteran trying to pay for a room and not doing what I will call it now turn and burn, but before that I told the VA that it was a suicide run, and the next thing I knew, I had doctors calling me asking me if I'm okay. But when you drive 306 miles to Anchorage, do a doctor's appointment and drive 306 miles back, you may or may not make it home. Tiredness, everything else, or even just pulling over and trying to sleep at 30 below is unaccountable. I mean, so, and we have it in the lower 48 too, where you just can't get to the same deal, same day. Planes don't fly. So we just got to take care of our veterans wherever they're at. And I know we're coming to the end, and here in about 8 minutes, they're going to cut us completely off. So if there's any questions, can you please put them in the chat, and we'll make sure that the VA gets them. And we do have a few more minutes before it does council over. So if there's anyone out there that has an urgent question they'd like to ask and only have a few minutes to do it, Nate, and AC, can you check?
I don't see anyone with their hand raised, Chief Bill.
All right. Well, if that's the case, if there is any questions, please put them in the chat box.
Oh, I do
And
see
we'll-
one person. Sorry, I do see one person just raise their hand.
All right, thanks, Chris. Can you unmute them?
Absolutely. Okay.
Hello?
Hello, Stephen, we can hear you.
Yeah, thank you. Yeah, my name is Steve Tidla. I'm from San Carlos Apache Reservation, and I'm a veteran of Marine Corps, United States Marine Corps during the Vietnam War era. So my comment is, I think that I'm encouraged by the comments made by the Veteran Affairs people. And I just want to make a point that, as tribes, We've always been at BIA listening sessions, and different federal agencies have listening sessions. And this is the first listening session that I've heard from the Veteran Affairs, and I think that I'm encouraged by the comments. But I think that we as tribes, I think we're more interested in action sessions rather than only listening sessions. So I think that as a result of our response to your comments, whether it be in writing or email or chat or by the esteemed leaders of the National Indian Health Board, that I hope that the Veteran Affairs officials will do an action session as a result of our comments rather than just listen. Because if you just listen, your high officials in the very important positions, if you just listen to us then and don't take any action, then it's all for naught. And then next time you speak, we won't be likely to believe what you're saying. But if you take action after our comments here, then you're going to be more credible as you come on down the road. So, but I wish to thank you for your service, and thank you, Chief.
Thank you, Steve. And from one brother to another, welcome home.
Thank you.
So hopefully you heard and listened to what Steve had, because it's very important. It's what all our veterans saying. And I know we only got about 4 minutes left to go. So before the Zoom just cuts us off, and when we're in person, we can continue to talking, but this is Zoom world. So I would want to say, Awada, thank you for those remarks. We appreciate you being with us today, and we'll be following up with you and your team on the issues discussed today. We know that having this time is important. It is also critically important that we track the progress of these recommendations. We trust that the VA will help to support our recommendations, and the tribal leaders across the Indian country will work to make such lawmakers also know what our priorities are. We do have several other events today, including a listening session with the CDC, which is will start at 2 p.m. Eastern time, and a listening session on health equity, which will begin at 4 Eastern time. We hope you all join us for these sessions. Also, please remember to stop by the virtual exhibit hall and marketplace to see the great offerings and connect with the vendors. Hawata, thank you again for our speakers and our audience members. Please take a few seconds at the end of the session to fill out the evaluation. And on behalf of the National Health Board, I appreciate you all being here. And if Stephanie, if you want to have any closing statements, we only have a couple minutes.
Chief Bill and Councilman Lewis, and I just wanted to thank NIHB and for your gracious hosting of this event. I think we echo the remarks and sentiments by our secretary. He's very no nonsense. He's committed to the well-being of our veterans, of our Native veteran population, and he will beat up people, figuratively speaking, in the building to make sure that we get it right. So I just really thank you all for your time today. This is a very exciting time. There's a lot of activity that's on the horizon for us in the near future, and we look forward to, in addition to future listening sessions, an action session where we can really talk about and identify what the deliverables and the difference that has been made between now and 3 months, 6 months from now for our Native veterans. So thank you all, and we really appreciate your time, and we'll stay in touch. I also put a link, tribal government consultation at va.gov. If there's questions or comments that didn't get said or covered, please send those to that. I know our boss, the secretary, and our immediate assistant secretary will be asking about that. They hold us accountable. So if you have any questions, please let us know and we will elevate those. So thank you so much for your time.
Thank you all for being here, and you all have a good rest of the day. And like I say, thanks again, Awata, for listening. Bye.
Bye. Take care.